The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Shifties, welcome back to the next episode. Dr. Andrea Coyle here. I am so thrilled today. We're going to talk about some exciting shifts going on down in Dallas, Texas. And coming to us from Dallas, Texas is their Chief Nursing Officer, Dr. Tammy Webb. And Tammy, I'm just going to have you do your introduction because you're doing so many great things down there in Dallas.
Thank you, Dr. Coyle. I'm so honored to be here and be a Shifty. I'm very excited. I feel very cool. So I am actually the Chief Nurse Executive at Children's Health System of Texas. So that is the traditional Dallas Children's Hospital downtown. And we also have a hospital in the northern part of DFW in Plano. So we are about 600 beds and a very large ambulatory footprint. And we are building a future hospital within the next 5 years. We will actually have a brand new hospital campus in Dallas. So I actually oversee all of nursing services for the entire system at Children's Health. I also have the privilege of overseeing quality and patient safety, which is a huge passion of mine, as well as patient experience. So I have been in Dallas for 6 years, and prior to that, served my entire career of leadership at Arkansas Children's. So certainly a pediatric nurse at heart, and I'm really excited to be here. I'm incredibly passionate about our future nurses who will be caring for us and carrying our profession forward.
And that's why, Tammy, I know your passion runs deep, and it's all about the shift. And when you started to share with me all the great work you're doing down there, I thought, oh my gosh, this is a shift. I mean, it's a shift on the way we do things. So can you explain to the shifties the work that you're doing, how you're collaborating with schools of nursing? I just think it's really incredible work.
Yes, absolutely. So just to kind of share a little storytelling, because I think that is what always seems powerful to me, is I came here 6 months before the pandemic hit us in the world and in healthcare specifically, and really disrupted, right? Everything that we kind of knew, everything that how we had trained and onboarded nurses and nurses school experience and all of those things changed. And the world began to be aware that we actually have a pretty critical nursing shortage that only worsened during that time. But I think there's a misconception, and it really came forward even within my own executive team of we don't have enough nursing students. And that is actually not true, especially in my region. We have a ton of young people that want to become nurses and join our profession, but it's one of the most difficult degree programs to get into because of the lack of nurse faculty in the schools of nursing. So when someone would say to me, why don't you just create your own nursing school and produce your own nurses in your organization? Well, because I'm a hospital. I'm healthcare. That's our business. The academic schools of nursing are the business of, training our nurses and bringing them into the profession. But the truth of the matter is, and statistically for me, for every 8 new graduate positions that we have, or for every one, excuse me, every one position we have 8 very highly eligible new nurses we could hire, but we're only hiring one of those 8. So it's very competitive in the nurse residency programs that people want to choose. But also the other problem is there's thousands of nurses in Texas right now that are incredibly smart, who's performed wonderfully in their undergrad programs, and they can't get a position in a school of nursing because the lack of slots for faculty. So with that said, if you remember many, many decades ago, we identified a shortage of physicians, right? And so we put in the GME funding, the federal support, but we haven't really done that in our nation yet for nursing. So it's really been on the burden of the schools and the hospitals to try to figure that out. And I do believe there's a great alliance and partnership that we can do together, because if they don't have the faculty, I have the nurses, I have the experts. So how do we somehow shift and get our resources and their resources shared in a different way so all these amazing young people wanting to join our profession have a place?
I just think when you shared this with me, it's actually brilliant. And talk to me a little bit, and talk to me and the shifties, of course. How did you come up with this idea?
Well, so certainly living many, many years of overseeing nurses and education, it's been a chronic problem. But when I went back to obtain my PhD, my research studies have really been about the impact of nurses, not so much studying like research around patients or patient population. And so when I looked into that work, and I'm really trying to do the return on investment of why residency should really be required in the nursing profession, I began to really understand why CNOs like myself struggle to make that ROI, because there's not a lot of impact outcomes in the literature about healthcare outcomes in places that have residencies. Now, with that said, in all of my extensive literature review, what I did learn is there's impressive outcomes around nurse satisfaction, nurse retention, competency, and confidence. All of those things allude to we have better health care, right, because of the nurse outcomes, but we've never really demonstrated in our nursing science that there is an impact to the patient outcomes. So my studies and my work were really trying to identify, does it reduce hospital acquired condition? Does it improve length of stay? If these nurses are trained through a residency, what is the impact to the patients? And until in nursing we begin to prove that impact, we will continue to struggle with, I actually, I'm so honored to be in an organization that values a residency and has the resources to do so. But there's so many hospitals and nurses that don't also have that experience. And I think it's one of the reasons they potentially become dissatisfied and leave the profession.
And I think that's such a challenge right now in the current landscape of the nursing profession. And I'm just, I have to ask this question. I'm going a little bit off script, Dr. Webb, but SC Healthcare, we're a burnout prevention software as a service company. In your work, do you see burnout starting in the nursing students?
So I think the excitement and the engagement scores that we see in the new graduates are fairly high through year one. They're out of school, they're super excited, they're learning. We are wrapping ourselves around them with support and mentors and preceptors and all of their supportive elements for a year to 18 months. Where we begin to see some of the disengagement or disenchantment, I call it, with a profession is more in the 2 to 3 year mark. And if we lose them at that mark, we may never get them back into a hospital setting. They will either leave the profession or they will choose nursing either in some other industry or some other setting besides inpatient. So that's where we really start to see the, kind of the what they call reality shock
Mm-hmm.
of their experience. So it's really, if you grab them in the first year, and I believe really nurture them in a residency program that's evidence-based, that's built on the, national standards, and they will have a higher level of confidence. And the other thing we see too, even in our own residency, is sometimes our academic preparation doesn't really prepare them for the human connection experience. And we really saw that in COVID when they had to go to a lot of simulation and less human factor. And so that's really impacting their ability to handle some of the psychosocial issues people experience in healthcare that really are the responsibility of nurses. So moral distress to, certainly the burnout at year 2 and 3 and the work, right? I mean, the work and the shifts and the overtime, all of those things are a factor that we continue to struggle with.
You said something that's really impactful. When you have a really robust, strong nurse residency program, you instill confidence in the newer nurses.
Yes.
And I think, in the work that I do and just speaking with people, I had a wonderful nurse in Boston. She had been a nurse for 6 months, and she said she was already feeling some of the cardinal symptoms of burnout. And it was because she didn't feel confident in what she was doing. And so how do you down at Children's Health, how do you address that confidence? What do you embed in your nurse residency that really helps build the confidence?
Well, first of all, we measure it. We measure it all along the way through many different tools, whether it be a survey, or an observation or validation of their competency, so that we're intervening really early for them so they never feel like they're alone. A very strong preceptor program. So our preceptors have to really be highly trained. All nurses don't know how to teach, right, immediately. And so we even have a preceptor coach program. So we have coaches for our preceptors that precept these nurses, and then additional mentors that are probably not their actual preceptor that's doing the training and the competency, but a mentor of someone who's been there or been through that they keep with them sometimes for many, many years. I think mentorship is incredibly important. But confidence, and understanding where they're not confident, we need to know that data. So then we completely evolve our programs, and also working with our schools of nursing to know what are they learning in school that they're not going to get, that here, or vice versa, that I need to make sure they get here. Pediatrics being so specific, we've continued to reduce that curriculum just with all the faculty reduction in the schools. So our transition to practice, I just can't imagine how a nurse could ever get to that highest level of confidence without it.
So the transition to practice is, I mean, this is the secret sauce. Do you have, I know you're PTAP accredited, or
We're CCNE, 10-year accreditation. So amazing outcomes. Yes.
so that all the great outcomes that you're looking for. How do you, I love that you said you're working with the schools and the faculty, just for the shifties that want to learn more, because I guarantee, I'm telling you, Dr. Webb, after this episode, people are probably going to reach out to me or you, because this is such amazing work. How do you, is it you directly? Is it someone on your team? How do you create those relationships with the schools and the faculty? That's key. That's critical.
So certainly it's a what can you do for me and what can I do for you? So you have to come to that common purpose together. And we actually have two different levels of partnership. Well, first of all, the number one foundation is we want to be the premier pediatric clinical site for nursing students. We have over 1,000 nursing students in our hospital. We did not close that program during the pandemic because we knew that was not the path forward. And so certainly being a great partner for their students to be in our hospitals practicing. But one thing we did that was fairly innovative, we started 5 years ago, is we said, academics, what's the value for them? They need tenure, right? They want to do research, and they have their doctorates, they have all the tools, they have statisticians. They don't have patients. And they don't necessarily have clinical nurses that can contribute the data for what they need to do their research. So that's what they want. And on my end, I have nurses that want to have an impact on the care of the patients that are in their care, and they want to do research, but they don't have the statisticians and the academics and the faculties and the doctorates. So that was the first thing we did, is we built these research alliances. They're completely zero sharing money. We certainly try to get grants together, but it isn't like either one of us is paying the other. We are sharing our resources. And since we did that, we have 2 schools now. We're working on the third. We are disseminating a ton of literature and podium presentations and doing amazing research. The one that's really highlighted that has continued to grow into multiple studies is health literacy and how nurses navigate healthcare for people. So that's been super powerful. And then the schools were like, wow, if we can do that, what else can we do together, right? So now what we're working on is shared faculty. So I already have some adjunct faculty that work for me, but they also work for the school when they're not here. But we want some more shared positions. So if a nurse doesn't want to work 2 jobs, but they want to, they don't want to lose their patient care. So they want to do clinical care a few days of the week and then do their academic faculty. Well, those are the nurses training my new nurses. I mean, it's a win-win for all of us, and it gives faculty back to the schools that's funded by the hospitals. So that shared vision is just coming forward. There are a few others in Texas that are utilizing some of the Texas grant funding for nursing academic education. But to me, that's our path forward in the future.
Wow. I'm just sitting here thinking like people are going to listen to this episode and take notes. But I do have a question. You answered a lot of the questions that I was going to ask you. I was going to ask about grants,
Yeah.
publications. Do you have a publication or two that you'd like to share with the shifties so they can go read?
Sure, absolutely. We've done some podium presentations. I've certainly have published my literature review in my study around the impact of residency programs. And then we also have a few of my nursing excellence leaders that have been publishing on the academic affiliation. And actually, the one that we're doing with one particular school of nursing, we're receiving a national award from the National League of Nursing in Washington in just a few weeks. So that dean and myself will be going to accept that award. So hoping to make a lot of connections then for other people to learn from us, but also from us to learn from other people. Just got back from the ANC Magnet Conference. There were several academic partnership lectures going on. People are really starting to work together in a really innovative and positive way. Yeah.
Well, I just keep smiling. I just have to say thank you so much for your leadership and thank you for number one, advancing the profession, being a forward-thinking leader. And then, of course, I have to say thank you for making all these shifts because we have to make shifts to adjust. And you're like the epitome of a top dog shifty. So thank you for that.
Thank you. It's my honor to share.
Typically, we end the podcast with a couple lessons learned.
Okay.
If you could share one or two lessons learned for people that are like, oh my gosh, I just listened to Dr. Webb and I am so intrigued. What are two big takeaways?
I mean, I think that for, a lot of my job as a CNA is translation, right, of what nursing is. And I'm always stunned a bit by the lack of awareness others have about how nurses are trained, how they become competent and transition to practice. We're not a work group, right? We are our own discipline. I wish nurses were credentialed instead of hired in hospitals. So I think that's one huge learning is you have to continually be able to promote, defend, and celebrate our profession. So that is certainly one major learning. I think the second one is don't assume that the schools are very rigid. I mean, we sometimes look at the academics and say, wow, they have all these rules and standards and it's really strict. They're actually quite open and inspired to work, and they need us as much as we need them. So I think that mutual relationship and partnership has been really empowering.
Well, thank you for that. That's really helpful information. And Dr. Webb, I am going to ask that maybe in like 6 months, you come back on the podcast, give us an update. Of course, we want to hear the progress that's going on. And thanks again for sharing all your knowledge and sharing all your science because, we're nurses, we're rooted in science and evidence. So thank you.
Scientists, absolutely. Thank you.
You bet. And so shifties, remember, your shift makes the difference. Keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.